If you are over 50 and you've had an MRI scan because of your back pain or other symptoms related to your spine, there's a good chance the report has mentioned the phrase degenerative changes. Whilst this phrase might sound worrying, most of the time it actually isn't. My name's Anthony Ghosh, I'm a consultant spinal neurosurgeon and director of the Spine MDT. And in this video, I'm going to explain what degenerative changes means, the different types of changes, and when it actually matters. Here is a typical MRI scan of somebody with these features. The term degenerative changes is a simple term for wear and tear. Most people above the age of 30 will have a degree of it without any symptoms. So this image on the left is a series of vertical slices through the spine. Here's the front of the spine and the back of the spine, and the spine is made up of a stack of bones known as vertebrae. A vertebrae consists of a cylindrical block of bone, shown here, and an arch of bone with some processes that muscles attach to at the back. When you stack these on top of each other, you create a kind of tunnel in the middle known as the central spinal canal, where all the nerves run through. And then between each bone, we have these cushions called discs, and that's exactly what they are. They just cushion the bones. So here on this scan, we can see that some of the discs are dark, so we call that degenerative disc disease, and that's a very common finding, and a couple of them might be slightly flatter than the other discs. They may even bulge slightly. Also, if we look at the back of the spine, if I scroll to the side a little bit, here are the joints that join the arches of the back of the spine together. So these are demonstrated on this cross section here. So if I slice you across the waist at this level here where this blue line is and look up from underneath, this is the image I would have on the right. This is the front, here is the back, the right and the left, and this here is the central spinal canal, the tunnel that all the nerves run through. And either side here, where these arches are at the back, these are the facet joints. So degeneration of facet joints or facet joint arthritis simply means a bit of wear and tear in the joints and therefore some overgrowth of these joints. Another term commonly used is the formation of osteophytes. So we can see here at the front of the spine is this kind of bony knuckle. This is where the bone below and above the disc try to join together, almost to try and stabilize the segment, and that forms a knuckle or an osteophyte, which is also under the umbrella term of degenerative changes. That's also referred to as spondylosis. So when do these changes actually matter? Well, let's say the facet joints are so overgrown from wear and tear that they start to grow inwards, and as well as that there's thickening of the ligaments shown here. If we scroll down to this point here, we can see that central spinal canal there has narrowed and shut down almost. This is what it should look like at the level above, nice and wide and open with lots of room around the nerves. But at this level where there is facet joint hypertrophy or severe facet joint degeneration, as well as ligament thickening, that's almost shut off completely, compressing the nerves, and this can typically give you pain radiating down one or both legs that tends to be worse on standing or walking for a period of time. If we come to this view here on the left and scroll to the side, these are windows here through which a nerve leaves the spine, and sometimes degeneration, wear and tear of discs, facet joints can narrow down that window and cause pinching of the nerves, again causing pain shooting down the legs. That's worse on standing. Sometimes the wear and tear of the facet joints at the back can be so severe that you develop a spondylolisthesis, where one bone slips forward over the other as demonstrated here, and that can also cause pinching of nerves with pain down the legs, or simply really bad pain in the back when weight bearing. If we specifically discuss disc degeneration, that's a common finding, but sometimes disc degeneration can cause a significant tear, as demonstrated here, with disc material, the stuff in the middle of this disc space, herniating or protruding outwards into the spinal canal. And if we come over to this image here, a cross section of where that line is, you can see all of this disc material filling up that spinal canal, pinching the nerves, again causing sciatica. Here is some data from a study that looked at MRI scans in adults of different ages who do not have any symptoms. And if we can see here, these are the different types of degenerative changes or wear and tear changes. So disc degeneration, signal loss, disc bulges, facet joint degeneration, and many others. And then in the different age groups, we can see the percentages of people with these changes. At the age of 50 and up, we can see that 80% of us without symptoms will have some form of disc wear and tear. And then a good number of us will have all of the other mentioned changes without any symptom. So a good clinical assessment is absolutely everything. These findings are seen in people without symptoms, so we have to be able to correlate that with your clinical signs and symptoms. As a surgeon, what I'm mostly concerned about is, are your nerves that control your day-to-day functions, like the movement of your legs, for example, are they at threat, or is the stability of your spine at threat? And that's what I'm looking for, both clinically and with your scans, and tying that all together. So as a surgeon, if I'm satisfied that your nerves are not at threat based on your symptoms, then I will often work with one of the physiotherapists or osteopaths, depending on the specific findings of your scan, and together we'll try and decide if there is indeed a target on your scan that could be the culprit of your symptoms, and then together work out a non-invasive strategy to try and improve your symptoms. I really hope you found this video helpful. If so, please click that like button and do subscribe to the channel. Also visit us at spinemdt.com to see how we can help you. Thank you very much for watching.